Hi there. This is Dr. John Whitcomb talking about, do birth control pills make you get breast cancer? The answer is yes. The question is, where from and what's the nuance and the devil in the details? The study comes just this last month, published in the New England Journal of Medicine from Denmark, where over 1 million women were followed for over 10 years. This is a big study. And they looked at all sorts of birth control pills and IUDs and such. And what they found was that instead of getting 55 breast cancers per 100,000 per year, they got 68. That was an increase of about 13 per 100,000 per year. That comes down to, it sounds like a big number, but it comes down to about 0.5% more women over the course of a lifetime, in fact maybe even smaller, will get breast cancer. Now that sounds horrible, but you have to put that into context. And the context is what it's avoiding also completely safe. And pregnancy isn't safe. Pregnancy is dangerous. In fact, it used to be the #1 cause of death, or very high on the list of what killed midlife women. And until we came along with clean obstetrics where doctors washed their hands and learned sterile techniques so that we could do surgery safely with C-sections, and until we had good nutrition and all the rest of that, an awful lot of women died in childbirth. Today, maybe in the range of advanced societies of only 12 to 20 women per 100,000. And in third world countries, maybe as many as 240 or so women. The World Health Organization reports that. So there's still a lot of women dying from pregnancy. So if you say 12 are dying per 100,000 and 13 are getting breast cancer, it comes out about even. So pregnancy is a risky disease. It's got its own inherent risks. It also has its own inherent wonders. And the family and love that brings can't be duplicated in any other way. The question is, can you soften the risk? And here's some suggestions. One is, I think it's actually the progestins that cause breast cancer. And there have been multiple studies that show that progesterone is actually, real progesterone, is a wonderful anti-breast cancer drug. And these studies have been published where women, for example, who've had horrible PMS syndrome, or women who've been studied for infertility, have shown that the lower your progesterone is, your natural progesterone, the less breast cancer you have later in life. And so it's probably a good idea to consider having human progesterone as one consideration. But breastfeeding, if you're a pregnant woman and you've been consider breastfeeding, please do. Not only does your kid get smarter, but for every 6 months of breastfeeding, your risk of breast cancer drops somewhere in the range of 15%. So 15-16%, if you breastfeed for a year, you've just reduced your risk of breast cancer 30%. If you have 2 kids, that's 60. If you have 3 kids, you've dropped your risk dramatically. Get the gist? You don't have to have 15 children and breastfeed all that time. And also think of taking vitamin D. That reduces breast cancer. Think of taking vitamin K2. That works with vitamin D. Think of taking iodine, 1 milligram a day. That works with breast cancer. All of those things are risk-reducing things. And if you're taking the birth control pill, every 5 years, take a 6-month break and use a different kind of birth control. Allow your body to get back in its normal rhythm and think about that. Those are all options that work. In the meantime, it's a risk-benefit that only you can decide. What will work for me? Well, I would encourage all the above. I would say, think about breastfeeding, think about taking the vitamins, think about how you can shorten your use of birth control pills and get down to maybe using a surgical technique that when you've had enough children. This is Dr. John Whitcomb saying, do birth control pills cause breast cancer? And the answer is yes, but they also prevent a lot of other things, so it's the risk you have to consider. Thank you.